All right. Good morning, everyone, and a very warm welcome to all of you to the roundtable discussion on Idea V, Innovative Distribution and Efficacy Assessment for Vaccines, jointly organized by the Office of PSA, Government of India, and CSR Box. I'm Bhagyashree, and I'll be coordinating the session for today on behalf of CSR Box. Before we begin the session today, we have some instructions for our audience. Since we are using a virtual platform, you may likely experience time lag. In case you have a query, please use the chat function and address it to the public. To avoid any disturbance, your microphone should be kept on mute and video should be kept off unless you are asked to speak. In case you get logged out of the meeting due to any technical issue, we request you to immediately rejoin using the same meeting link. Please use the chat box to share any questions, comments, or queries that you have for our speakers today. We are privileged to have Professor K. Vijay Raghavan, the Principal Scientific Advisor, PSA, to Government of India, to join us as the session chair. Welcome, sir. We are also glad to have Dr. Anupama Shetty join us as the session moderator. Dr. Anupama Shetty currently serves as the Mission Director at Biocon Limited. She is a physician with a master's degree in hospital administration and has also gained her PhD from TIS Mumbai in health system studies. Welcome, ma'am. So without any further ado, I would like to hand it over to Dr. Anupama to set the context for today and also moderate the session further. Over to you, ma'am.
Thank you for the kind introduction, Bhagyashree. Good morning. I would like to welcome all the participants for today's roundtable discussion on Idea V, a concept for industry participation by the Office of the Principal Scientific Advisor to the Government of India. It's an honor and my pleasure to introduce Professor K. Vijay Raghavan, Principal Scientific Advisor to the Government of India. Professor Raghavan succeeded Dr. R. Chidambaram as a Principal Scientific Advisor to the Government of India on April 3rd, 2018. Earlier, he served as Secretary, Department of Biotechnology for the Government of India from January 2013 to January 2018. Till then, he was the Director of the National Center for Biological Sciences, NCBS, Bangalore, where he continues as a Distinguished Professor. He was instrumental in establishing NCBS Bangalore under the aegis of Tata Institute of Fundamental Research and moved on to NCBS in 1992. His fields of specialization are developmental biology, genetics, and neurogenetics. Before we begin the roundtable discussion, I hope to quickly set the context and also highlight the agenda. The COVID-19 pandemic, as we all know, has been a crisis of unprecedented proportions and implications. More than a year into the pandemic, nations and governments across the globe have striven to find appropriate measures and means to respond effectively. The past year was witness to incredible efforts to develop and deploy safe and effective vaccines. Vaccines typically require years of research and testing before reaching the clinic. But in 2020, scientists have embarked on a race to produce safe and effective COVID-19 vaccines in record time. Unprecedented scientific collaborations and financial investments have changed how vaccines have been developed. The COVID-19 vaccine candidate development is an evolving landscape. There are currently more than 50 COVID-19 vaccine candidates in trials. India's drugs regulator recently approved 2 vaccines for emergency use authorization in the country. India will commence its COVID-Vaccination Drive from January 16th to 2021 after the forthcoming harvest festivals. Around 30 crore people are estimated to be vaccinated in the first phase, with priority being given to healthcare workers, frontline workers, followed by those above the age of 50 and the under 50 age group with comorbidities. This is going to be the globe's biggest vaccination program. Considering the massive scale and the inherent contextual challenges and complexities, the government and the industry would need to come together as true partners. In today's roundtable discussion, chaired by the PSA, we hope to understand more on how the industry could contribute. In the note shared earlier by the Office of the Principal Scientific Advisor, Innovative Distribution and Efficacy Assessment, or Idea V, has been mooted as a catalytic initiative to engage industry partners. I would now request Professor Raghavan to elaborate on the concept. Thank you.
Thank you very much, Anupama, and thank you, CSR Box, for organizing this. This is something which, if we take off well, and I'm sure we will do, will be an absolute game changer. And I'll try to elaborate why this is important and why this can have such a huge impact. The pandemic is something which had been discussed and potentially argued about the dates when it will come and what kind of pandemic will come for several years. But it came upon us early last year in a manner which, even though we knew that pandemics will come, we were not, ready for what happened on this scale. And this is analogous to our having a seat belt in a car. Many of us follow instructions and wear the seat belt, but many others think that accidents happen to someone else, and since an accident hasn't happened, no seat belt is necessary. So this is a wake-up call for us, and we actually did two things in India which I think are very important. First, we responded well, and we distinguished, compared to other countries, the difference between preparedness and response. Many countries had an extraordinary preparedness, but because of the complexity of what hit us, the response was slow or not nimble enough. We, for a variety of reasons, could respond in a manner which was a little more nimble, and we can go into those reasons later. But remember, there are three factors at play over here. One is the virus itself. Its properties, the way it infects people, asymptomatically and symptomatically, are all very important properties which science has discovered. And we've discovered which way the virus traverses through testing and tracking and by a variety of other methods. So that's about the virus. But how we respond is another big challenge. How does it affect our body? How ill do we become? Why do some people become more ill than the others? How can we save lives? And so on and so forth. And the third point is what we are going to discuss now. What is the escape from this through drugs and vaccines? Drugs we are setting aside because that's a separate topic. It's about vaccines and vaccination. So in this whole progression of this pandemic over the last year, I would particularly like to thank all of you, the corporate donors, the CSR box and several others. We have worked with many industries. I'll just suggest list a few as examples. There are many more. PNB Housing, Infineon, Standard Charters, Chartered Bank, Microsoft, Cognizant, Intel, Cummins, SBI Foundation, Daimler, the Gates Foundation, Rockefeller Foundation, and many others funded about 56 projects, which related to COVID-19 ventilators, mobile diagnostic labs, RT-PCR setups, antibody testing, masks, reagents, personal protective equipment, and so on. So this is absolutely stunning how CSR came together in this. Now this is important because CSR often goes to the last mile and sees what can be done. But if it steps a little further ahead, one or two steps before the last mile, and in addition deals with the last mile, then the impact is enormous. And that is seen by all of what you have done for all the areas I've listed. Now, let me come to the point at hand, which is about vaccination. Vaccines, as Anupama said, take usually 5, 10, 15 years to develop. Why is that? Because typically people, see diseases coming, then they think that they could be vaccine preventable. They prepare candidate vaccines in their lab, they test them in petri dishes, then they test them in animals, and then they go to what are called phase 1 trials. And the regulator usually looks at, the application for phase 1 trials, and if it's rigorous, they say go ahead. But vaccine developers have to get resources for this, and resources are always extremely difficult to come by. The principal resources which people get all over the world, sadly, are for vaccines and drugs which are related to diseases which affect the rich in the world, largely in the West. Therefore, vaccines for diseases which affect people in poorer countries or people all over the world, funding is difficult to get. So we knew about coronaviruses, we know about Zika, we know about Nipah, we know about chikungunya, but vaccination programs in those progress very slowly because they didn't have a large scale impact. That impact happened last year. So people scrambled with great speed and wanted to make vaccines 10 times faster. Now, 10 times faster means, much more resources, much more money, of course, but it also means certain kind of parallel processing. While you're doing your animal trials, you also start getting prepared for your phase one trial so that the moment you finish this, you do the next. And that means, the resources have to be available in advance. Phase one is, largely about safety, and phase two is about immunogenicity. So you combine phase one and phase two overlapping so that you can go very fast. And then you can also, in parallel, manufacture and stockpile at risk. These require hundreds of millions of dollars of investment. Should the trials not pan out, then you have to throw away all of that. So these are the kinds of methods people use. Now, India is one of the world's largest vaccine producers. And, one of our companies, for example, Serum, is the world's largest vaccine producer. And 2 out of 3 vaccines which children get all over the world in immunization programs are made in India. So India is a great manufacturer of vaccines. What changed during the pandemic that India also became a developer of vaccines. And you've heard of 2 vaccines which have been introduced under emergency use authorization. There are many more in the pipeline, and this is very important because different vaccines will have different properties which will be valuable in different contexts. We can go into that later. But also, our need is going to be immense. And every single kind of vaccine is going to be, which is good, is going to be important. This pandemic will be there for a while. After we vaccinate the bulk of our population, it's going to have, a requirement of vaccinating again, those who have been vaccinated earliest, and we don't know how the virus will change. Now, in that situation, what is the role of CSR Box and our colleagues over here? The government has embarked on the largest vaccination program in the world. Our first efforts are directed, and that will start on January 16th, on frontline workers and healthcare workers. But in parallel, we will start with about 26 crores of people who are over 50 years of age. This is a huge sum. This all adds up to about a total of 30 crores, which is larger than the population of many, many countries. So this is the priority group of 30 crores. And so that will need 300 million doses for the first shot and 300 for the next. So 600 million doses we will need overall. So this is simply enormous in terms of its challenge. And this priority group vaccination will get done in 7 or 8 months. Now, the way the priority group vaccination starts is, as I said, healthline workers and frontline workers will start first. You imagine that's a train which is taking off, moving away from the platform. Simultaneously, the third train will start, which is people over 50. These different trains will go at different speeds initially because the vaccine availability is initially modest and the priority of the healthcare workers is highest. But very soon, in weeks and a month or so, these trains will start catching up with each other and move at the same speed because vaccine availability will be more. And the last point, very important for us today, is that the ability for us to vaccinate would be robust and well done. And that's what I'd like to come to you with, that we, each of us as residents of India, as citizens of India, need to come together to help this enormous network. This network has got a IT backbone starting from the manufacturing to the distribution and reaching to the last person. And that's a major IT platform. Even if you don't have a phone, even if you have a feature phone, you can register and then get vaccinated. You'll get a time for vaccination. Then there's actual vaccination program. And of course, layered on this is the distribution of the vaccine. So there's enormous room for us to come in on this and make sure that we choose some sites, make them as model sites, work with the government, the local health ministry, the national health ministry, to see how those sites can do a terrific job and then give feedback. Now, at the site of vaccination, there'll be many, many kinds of questions. Should I take, when will I get the second dose? What is the side effect? What is not? So we will need to have multiple kinds of training for people who go out and train people and help people, manuals in multiple languages, and communication over YouTube snippets and other kinds of mechanisms from the PSA side, from other sites, and so on. So this is an enormous job. If you focus on few locations and have those as our physical sites, and combine that with the generation of information which can go all over the place, we would be adding enormous value, just as you all did in testing and tracking and making PPE and ventilators and so on. Thank you very much.
Thank you, sir. So we had compiled a few questions which had come in from the corporates earlier on. Would you like me to kind of, address this?
Absolutely. Feel free to ask me anything which has come in earlier, but also those who are here should feel free to, raise their hands and ask whatever they want.
Sure, sir.
To you.
Yeah. So one of the questions which had been asked was, while there are structured priority groups for vaccination, would this strategy slow down the process of vaccination for the rest of the population, given that the objective is to vaccinate as many as quickly as possible?
Thank you. This is a very important question, and you must see this at two levels. One, from the perspective of why does one have priority groups? These priority groups principally fall into two categories. A crore of health workers and 2 crores of frontline workers who are constantly being exposed to many, many people who are potentially carriers or who are carriers. When they are protected, they can treat all of us. So that's one important priority. They take up a very small volume of the doses. A significant other priority group are those who are above 50. Now, typically, this virus attacks people most severely the older they are. In our country, the demography is such that those who are above 50, as opposed to those who are above 65 or 70, constitute a significant number. In this priority group of over 50, the vaccination program will start with the older people and go down to those who are in their 50s. So again, within that priority group, those who are most needy are being taken care of. Why is this? Why can't we just go right away and vaccinate everyone? That's because the way the doses of vaccines are being ramped up, in the first quarter, doses will be limiting. In the second quarter of this year, doses will not be limiting, and we will have multiple vaccines coming up. So this will expand rather rapidly. So you must see this priority group as something which is starting off and will change rapidly as the program becomes more robust and doses are available. And making the program robust is something which has to be tested on the ground, and that's where you also come
in. Thank you, sir. The next question was, as the production of vaccine increases in India, could the procurement of vaccines be opened up to the private sector with a price cap, as was done for RT-PCR testing?
Yes, indeed, that will happen. Remember, the vaccines which have been rolled out now are under what's called emergency use authorization. And when we switch to regular licensure, which will happen soon after the phase 3 results come in, then the regular licensure will surely allow the private sector also to come in. So very soon that will happen, and that will be along the lines which you've suggested.
Sure, sir. Thank you, sir. The next question was, could large groups of working age population, 18 to 59 years, who are largely mobile and active, be identified and vaccinated through CSR efforts? I think what they are pertaining to is like, slums, factories, colleges, wherein you have a large captive population who are in the age group of 18 to 59 years, sir.
No, this is very important. Where I think CSR would be invaluable is that these locations, and these locations typically are in our larger and middle-level towns and cities. It will be very important to have people of all age groups steadily being registered on the portal. There will be many people who don't have phones, who have feature phones. Feature phones will get feedback, but those who don't have phones, elderly, disabled, all of them, their registration, getting them to the sites when they can go, getting the vaccines, working with the government so that the vaccines can go would be very important. Remember, we have formed now what are called clusters of institutions in the National Capital Region, in Pune, in Hyderabad, and in Bangalore. And these are clusters of major government institutions, about 40 each in each city. These people would be absolutely terrific for you to work with to develop the logistics, the analysis for all of this at very high quality so that they can be scaled all over the country. So we've got an incredible team of people in these institutions, and we have some very, in each place we have a node. So you just need to contact that node, and within that entire cluster, everyone of every kind who's needed will come. So yes, what you've said is very, very important. And you must see the scale. It's just humongous what we need to do. We need the 300 crores, 300 million is just the beginning, the 30 crores. We have to go through that again and again and again. So this needs to be laid down in a very systemic manner, and your collaboration with the clusters would be very valuable.
Thank you, sir. So you mentioned registration on the portal, but the next question is, with reference to challenges in digital registration. So the question goes as such: there will be large populations in the informal sector, migrants, basically who will have challenges in digital registrations. ID proof they may not have, but they're also very vulnerable. So how would such populations be addressed for vaccination? Or is there any strategy which has been thought out?
Absolutely, absolutely. I must stress what the registration is there. It's there at multiple levels. It's there for you to do on your smartphone, on your feature phone, for groups of people who are connected with ASHA or Anganwadi context. They help people who don't have these to get registered. So there's a tiered way of making sure that everyone, whether they have access to technology or not, are registered. That will not be an issue in terms of the structure. In terms of the practice, that's where our coordination is needed. The IT end is not about registering, getting the IT to the individual. We should have an IT end to say, have we gone to this, unorganized sector colony? Have we met everyone? Have we got everyone registered? Have we given them a paper with a QR code on it so that they can, go to the center at an assigned date, and someone at the center can scan the QR code and knows that this is the right person? These are all things which need to be done, which the government is doing. But to make sure that they're efficient and scalable is where our partnership is very, very important.
Sure, sir. Thank you for that. So the next question is about, from the Ministry of Corporate Affairs, we recently heard that the corporates can get involved through their CSR, grants in terms of vaccination or supply chain partner and the local community. But even if we had to do that, would the government be issuing protocols? And when would they be issuing protocols for us about how do we vaccinate our stakeholders, which is the supply chain partners and the local community?
Absolutely. So that's where, those protocols will be issued by the government. But, our office would be happy to work with you to synergize with government agencies to make sure that those protocols reach wherever it needs to be done. So those are the kinds of interfaces also where we can help. So if you have any questions about, whether the protocols have been issued or not, where are they, don't hesitate to reach out to us. I'm sure they'll be up on the Health Ministry portal, but we can also help you on that.
Sure, sir. Thank you. And is the government planning to involve civil society organizations in spreading awareness on COVID vaccination? And, could the CSR companies also leverage on CSOs or NGOs in terms of social advocacy?
Absolutely. There is a entire very strong government committee headed by Mr. Amitabh Kant, which has been over the last year. And I'm also, by the way, a member of the committee. We have been meeting NGOs and CSOs and so on to ask how we can help and how they can help in various programs. Now, those discussions have moved to how interactions can be strong on vaccination and vaccine delivery systems. So absolutely that is there. And again, there, if there's anything which needs to be communicated better, I'll be happy to help.
Sure, sir. Thank you. There is a question in the chat box, sir, which I thought I'd put across to you. So Mr. Ashwini from Godrej has mentioned, how prepared in the cold chain are we, and in terms of our logistics, sir? And is there any way in which the corporate CSR teams can contribute in terms of logistics and supply?
Absolutely. This is very, very important. And let me tell you how the cold chain works so that, each of us can see where we can contribute. First of all, there's vaccine manufactured in the factory in huge bulk. Then it gets in the factory, it goes either to another company nearby or right there. It goes into what's called fill and finish. Now, these filled vials then are distributed along a cold chain. They first go to very huge warehouses which are completely refrigerated, and there are about 5 or so in the country. And then from there they go to other warehouses which are smaller, and then other even smaller warehouses. All these are completely refrigerated, and the transport between them are also refrigerated by refrigerated trucks of various kinds. So this is all powered refrigeration. Now, when you start going from the smallest town where there's powered refrigeration to the vaccination center, these are in boxes which are cooled by packs which are kept at low temperature, and then they are not powered in their cooling, but they have to reach the site. The vaccination has to be done before anything warms up. All the samples are tagged so that if the temperature goes above permissible, you'll change color, the vaccines will change color, and you'll make out that the temperature is not appropriate. So this entire cold chain is in place. But imagine this is now being scaled up enormously to the healthcare workers and frontline workers, then to the priority groups. It will just keep going. So every way of making sure that the components needed for this from industry is available, of quality, is delivered to the right people. There's room for so much to do. What we can do is to do, in addition to what others are doing, is to have an analysis of each of these components and see where science can come to make this more efficient. Can you, have a way by which the distribution is such that you most optimally use your refrigerated samples? Can you ensure that samples don't go to waste? Supposing, in a booth, 10 people don't come up, or 50 people don't come because of the weather. What would you do? You cannot, go back. How can you get people? So these are all logistical matters which a combination of good sense and IT can deal with. And if we do this, we will be using our vaccines more efficiently.
Thank you, sir. Sir, you just mentioned in terms of, to have an analysis of each one of the components of the logistical supply, in terms of where do we, for example, an analysis of wastage reduction. Would there be nodal agencies whom we can collaborate with in terms of, say, funding research or, a kind of ongoing analysis of these activities? And how do we go about this?
This is a very, critical step you've asked about. If we don't want to add drops to the ocean, and if you want to have significant impact, we need to do it at a level of granularity which meets that goal. And that's why I brought up the concept of clusters. We have 4 major clusters, and together they add up to several hundred institutions of differing capabilities in every sector. Therefore, if you coordinate with us through Dr. Sapna Poti, so that each of the clusters can take on one or different goals and amplify that and have a responsibility to deliver, then within those clusters they can distribute, they can even talk between clusters. So that way the distribution is something which grows organically, but the responsibility for the outcomes is also fixed.
Sure, sir. Thank you so much, because this was one of the questions which was also asked. Quite a few people have been asking that whom do we get in touch with for such associations. So we would definitely reach out to Dr. Sapna Poti and see that, we can at least express our interest in whichever areas you've mentioned so far, sir.
Absolutely.
Yes, sir. And so then there is another question. We feel that there is a certain COVID communication strategy which has been shared. We have seen a document which was rolled out earlier, But has standard documentation for IEC and all that been, has it already, is it in place for smaller towns and villages? Is it something that we can take up and start perhaps, get involved in the dissemination program?
Absolutely. This is again something which is really important. The government, in partnership with state governments, has put in place all of this. All the material is there. It will be translated into multiple languages. But that is a sliver of government activity which often does not hit the large population where it needs to, for a variety of reasons. The way communication starts in government structures, the way people are jaded with too much information. So using the core information which is there without compromising the validity of that, or by making error in messages, it's very sensitive how one conveys it. Without making mistakes there, we can scale up the communication with putting it into new kinds of tools and new ways, both by actually going to locations and by using other electronic media to make sure that the communication is there. The government also has for its communication 24/7 hotlines available, so people can call up, district authorities, state authorities can call up and ask. Similarly, it would be good if the CSR sector, partnering with S&T institutions in local levels, also has a mechanism of feedback through call centers or chat boxes and so on to amplify exactly the same message. To summarize then, it's important that we don't miscommunicate, because sadly in today's world, miscommunication amplifies faster than communication. But at the same time, communication is very, very important, and we have an important role there.
Thank you so much, sir. So there's another question. Often it has been mentioned that zero surveillance would also be a very good strategy which could guide vaccination. And would ICMR be involved in such surveys? And if it is involved in such kind of research, can CSR funds also be deployed in supporting ICMR for zero surveillance surveys?
So let me first say that zero surveys are really very important. And the ICMR, many of our national labs, many of our hospitals in the non-government sector, top hospitals, all of them would love to do zero surveys on a much larger scale. And your partnership there is very important, and we would be happy to facilitate that partnership. That's very, very important. Why are zero surveys important? Zero surveys tell you whether the virus has affected people and to what extent in a population. And that's not an unimportant thing. That doesn't mean that they will not be vaccinated, because for a variety of reasons, the immune response varies in people, so that it's wiser to decide to vaccinate them than to assume that those who have high immune response need not be vaccinated, because the costs of doing all of that and logistically dealing with that is just not worth it. But zero surveys are very important to see how the disease is being contained and how it's spreading, and that must continue, as must another very important component, which is sequencing. Sequencing of the virus is important, combined with testing and zero surveys, because new variants are coming. Why are the new variants important? They're important for two reasons. One, some of them will spread faster, greater transmission, such as what we're seeing in UK and South Africa. That means many, many people more will be affected. That means it'll have a big impact on the system. Therefore, the sooner we vaccinate, the better. So that's about the spread. But given that this is a pandemic, by definition, it's all over the world, eventually, at some time, we will start seeing sneaking viruses coming out, which are also vaccine evasive. Sequencing is very important for that periodically, to look at the vaccines, the viruses, and test them in the labs. So vaccine evasive strains, vaccines against those can be made. So these are the kinds of areas where I would urge you to also consider partnership, because the government's focus on this is enormous, but you bring flexibility of a kind which can amplify 10 times, 100 times what efforts the government puts in. So your partnership in all these, sequencing, testing, zero surveys, they're all related to the vaccination, and I would urge you to consider that.
Thank you so much, sir. So to summarize, in fact, sir, you've mentioned quite a few areas, where we can synergize efforts with several institutions, as you mentioned, the nodal institutes with whom we can work. whether it is in terms of logistics or the cold chain, whether it is in terms of social advocacy, whether it is in terms of research. So I think we have quite a few areas, and also in terms of the protocols, we would be in touch with your office in order to understand when and how would be a good time to go ahead on, in this, in terms of supporting the vaccination campaign.
Anupama,
Yes, sir.
sorry, while I've outlined all the important areas, it's important for us, this group here, to see where we can have maximal impact now and what is maximally needed now, right? And that is something which is absolutely critical. We need to, focus on the vaccination drive now. And if we can put that in place, all other things can really come in place simultaneously. So, remember, all of you have already supported all the other components. Those things are going on. They can and should be amplified. But for now, let's have a very tight vision on what we want to do with vaccination.
Sure, sir. So, Bhomik, if there are any other questions, and so would there be any kind of a training which is planned for CSR inclusion? I mean, there are quite a few CSR, companies here who want to understand more. Having listened to you right now, we understand that there are quite a few areas, and it's an imperative to get involved right now in the vaccination drive. So, are you envisaging any kind of a session, another session, where a larger blueprint could be shared?
Yeah. So, our goal right now is to work at the stage of vaccine delivery, top down, and help that pipeline, and bottom up to make sure that those who are most needy and disadvantaged also get into the vaccination. That's a one sentence statement of what our focus is. We will work with you to make sure that there are training and communication programs for you, so that our central government, our state government, our others organizations in our clusters, all of them can get in touch with you and tell you this one sentence what it means to each of you, so that you can interface at the right location and get things done. Would that be a reasonable way of putting it?
Absolutely, sir.
Maybe we should also ask whether this is fine. Dr. Sapna Poti herself is here. Sapna, is that something which is a good way of taking it ahead?
Yes, yeah. So, couple of things. One is we are planning the cluster approach, where our research institutes will work with the NGOs of the CSR organizations, and basically to do the vaccination. But more than the vaccination, the training manual, the pre-testing, and those who need to be vaccinated, not vaccinated, and why they don't need to be vaccinated, plus the causes in case of any major side effects like death, etc. What are the causes? All of this is part of the R&D. Which is proposed. So the cluster approach and the 4 clusters that we are talking about would be the ones where we will pilot test all of this and then offer it to the rest of the nation. So that's exactly the project, and that's what we call Idea V project, where the CSR funds will be the catalyst funds that we will be using for this purpose.
Thank you so much, Dr. Sapna. Thank you so much. I mean, this was, yeah. So thank you. I was just noting all these down, Dr. Sapna. Thank you. And, Bhomik, if there are any other questions, because the questions which are coming at the chat box more or less address what has already, Dr. Raghavan has already kind of, shared his, has given his answers to quite a few of these. So if there's anything else.
I think most of the relevant questions where the department is concerned, I think we have been answered by sir. There are a couple of questions which are more on legal compliance and other things which are under the purview of MCA and the section.
Absolutely, yes.
So we'll discuss separate note and in a separate session.
Yes.
Most of the questions have been responded, and we have a good elaboration on all the processes and modalities now.
So I think, sir, what has happened is that, here on this platform today, everybody wanted to know how we could engage. And I think it's been very clearly indicated that there is a certain blueprint for engagement, and we would be in touch with Dr. Sapna Puri for further to understand, for instance, right now in the vaccination drive, how we could participate. And she had mentioned that the CSR funds would be used as the catalytic initiative here, as per Idea V. This gives us a lot of, hope, and in the sense that, because all of us here are definite in the thought process that we want to engage, we want to support the government in whatever way they see fit, without duplication of efforts.
Absolutely.
And also in those streams which are, the most value add right now and which are most impactful. And coming from your officer, this makes a lot of sense for us. So I will hand it over to you now, Bhome, because I feel Sir has addressed most of our queries.
Yeah,
may I just add one more point, Anupama, if I may?
Yes, sir.
I've been going through the list of participants. It's incredible to see the depth and diversity of people here. And
yes,
if we stay together on this focused point, we will have an enormous transformative impact. So thank you all very, very much for coming together today.
Thank you so much, sir. Thank you.
Good morning, everyone. So thanks a lot, PSA sir, for your valuable time and guidance that you have provided to the entire CSR fraternity today. This was much needed because for last 30-45 days, we were getting lot many queries from the CSR fraternity. And thank you to Dr. Sapna for coordination and everything, all the efforts that Dr. Taslim and Dr. Sapna has put in to coordinate with us and your office. Now I assure you on behalf of CSR fraternity here that will align with your expectation. In fact, we at CSR Box are trying to align with Dr. Sapna and create an FAQ which can really help all the CSR leaders to go for a structured process, because we understand that even the CSR heads get lot many questions internally from the top management to the other stakeholders, that how they are working and what is their plan for vaccination and aligning with the government priorities. So this session has really helped us to align with that, give us some thoughts for our ideation and next level of planning that CSR has required. In next couple of days, we'll come up with a more structured process which can help all the CSR fraternity. And then one important point which we are seeing, that there are a couple of questions which are in a transition question for legal requirement or under the CSR for employees. Vaccination, or even the vaccination in the supply chain, vendors and other things. So probably those clarification will, we believe they will come from the MCA side, which is not part of the research and the scientific discourse right now. So thanks a lot again from the entire CSR fraternity to sir. And thank you very much to Dr. Sapna, Dr. Anupama and Dr. Taslim for helping us curate this entire session. Thank you to CSR leaders who have joined us on Monday morning. We know that this is going to be busy week for all of us, including PSA sir, who has mandate, who has next lineup ready for him. So thank you everyone, and we'll coordinate in a better way. Thank you. Thanks a lot.
Thank you very much, Bhumik, and CSR Box and everyone here. Dr. Sapna Puri will work with all of us to make sure that you have really quality proposals which have great impact. Thank you.